Today we're going to talk about how your urine can give a clue on what is happening to your kidneys. Okay? Kidney disease is becoming more and more rampant. We're seeing it even in young people now. It's incredible, very concerning. So I'm going to tell you what to watch out for in your urine so you will know ahead of time if something is going on with your kidney. Like everything else, like I always say, when you find out on time, you have a better chance of taking treatment and getting back to normalcy than if the damage is extensive. Okay, so it's always good to know these things, these little clues. It will help you out. Number one, if your urine is foamy, like if your urine is looking like beer, constantly foamy, it means there's protein in your urine signaling something is wrong with the kidneys. What do your kidneys do? Like we have said in this channel, your kidneys have four major functions. It filters waste and toxins. It regulates blood pressure, the acid-base balance, and also balance water and electrolytes. So when you see protein in your urine, it should be concerning. And if it continues to be so, please go see someone as soon as possible. Okay? Because it's not supposed to be. Number two, if you have pink, red, or color-colored urine, it's signifying blood in your urine. Again, your urine is not supposed to have blood in it. So it can start suggesting kidney stone, tumor, etc. It could be so many other things. So get it checked out. Dark concentrated urine. It could mean dehydration. You need to drink water. Now, if your urine is too pale all the time, even when you're not hydrated, you also may need to get it checked out. So your urine should not be too pale. It should not be too dark either, especially when you're hydrated. When you're not hydrated, it might be a little concentrated, but when you're hydrated, you will see it lighten up, vice versa. But if it's constantly too dark, even if you're drinking a ton of water, or constantly too light, it might be something else. So get that checked out too. Another one is frequent urination at night. You're getting up multiple times to go use the bathroom. It could be a sign. If you're not urinating at all, you're having very small output, like you drank a gallon of water and you barely pee anything, that is also a sign that something could be wrong. Another one is cloudy urine or smelly, overly smelly and cloudy. It could signify infection. So get that also checked out. And I want to say that this is not enough to diagnose anybody. You need testing. These are just clues, things that will let you know that you need to look more into this, just in case. It's those early signs that should not be ignored. Because if you ignore it, things might get worse, if that is the case. So you need a proper diagnosis to be able to say that somebody have a kidney disease. So like I said, any of these that is persistent, because if it happens one time, it may not mean much, one, twice, or three, but if it's persistent, then it's something that you need to get checked out. Okay? Thank you all for watching. And don't forget to like, share, subscribe, and follow if you haven't already. Until next time, may God bless you. Bye.